Welcome to Unstoppable, where dreams turn into plans and plans turn into powerful action. Hosted by Paula Swain, financial planner, business owner, grandma, and queen of reinvention. This show is for women ready to stop surviving and start thriving. We'll laugh, we'll learn, and we'll tackle the messy, beautiful, in-between parts of life that no one really talks about, but we all live through. This is Unstoppable. Hi, and welcome to Unstoppable. I'm Paula Swain, financial planner and host of the TV show today. So we're going to talk about sexual health and wellness. I may be blushing the entire time we're having this conversation, but it sure will be fun. So we're going to talk about different, why sexual health is important, why you shouldn't be embarrassed about talking about it, and treatments for both men and women. So my guest today is Dr. Yasin from Skin4U Med Spa in West Bloomfield, I think, right?
It's in Commerce Township.
In Commerce Township. Sorry about that.
Okay.
So welcome.
Thank you so much for having me today, and I'm looking forward to answer your questions about sexual health and hormone replacement and all everything that pertains to that.
Okay, so let's just jump into it. Why is sexual health so important? I mean, I know for myself why it's important, but you know, some women and men do struggle with it.
Definitely. So sexual health is an important subject that's most of the time it's neglected or not taken into consideration. When some patients go visit the regular doctor, they really bypass that and don't open that subject. There are several things that stop them from doing this, which eventually make a lot of physical restraints, make emotional and psychological problems to them because it exists, but they don't want to talk about it.
Well, not only that, it's got to affect their relationships.
Definitely. So basically what happens is if a man or woman having some issues with their sexual health. For men, you know, erectile dysfunction is a big thing. For women, you know, problems with vaginal dryness and libido, they usually don't like to talk about those things with the regular doctors. So, and that again will create a burden on them psychologically, emotionally. It will make them more tired because they cannot talk to anyone about it, and in the same time, they want to have a better sexual life. So here we come. We try to help you to achieve that, and I will talk about it, and I'll let you know what we offer at our center.
Just listening to you, I'm thinking about, having to talk with someone, and I think it's probably harder for men than it is for women, because we at least have the gynecologist that we can talk to.
Yeah.
But for men, it's got to be a tough subject because it's all about their masculinity and their, just being a man,
Yeah. So starting the conversation for men is a little tough. And even us, when we first started to see patients in our center for erectile dysfunction and hormone problems, it took a while for us to get to the right a way to bring it into to the patients or how they can approach us. So, of course, patient confidentiality and privacy is very important. And I'm going to tell you, this is the thing that really stopped most men from talking about these subjects. Could be like a social aspect, could be a cultural aspect, could be a religious aspect, a lot of things. So we try to make it easy and feasible for patients to talk to us about it. So that's why we implemented a system in our center that make or let men and women access me directly without the hassle of going through the front desk and calling and making those conversations.
That's nice.
Yep.
That would make it feel more comfortable.
Definitely.
I can imagine it just, as a woman and having experienced certain things, and you have walked into the doctor's office or wherever you had to go and you had to explain, why are you here? And then you're like, oh, I don't want to tell you why I'm here. That's so embarrassing.
Exactly.
I'll tell the doctor, but you as the receptionist don't need to know.
Exactly. So What I created a system that the patient go on my website or social media and book a telehealth visit. And
Oh, so you're doing it all over.
we can do that, or they can opt into an in-person visit. So the difference is the telehealth visit can sometimes be more private. So people having sexual issues, erectile dysfunction issues, they don't want to show up in a place and be seen by someone. Okay, especially men entering a center like, you know, we at our center we do a lot of wellness, and at the same time we do aesthetics too.
Yeah, that would be embarrassing.
Yeah.
Here
so,
comes your buddy and you're walking out
exactly.
of that center.
So
Yeah.
we have two options for them, either to do a telehealth visit, and this will be booked directly through a Calendly or calendar application, and I will do the whole thing myself, okay, without the hustle of going through the front desk, calling, and making an appointment. If they want to come to complete the consult and do the physical exam and the other things, and we can bring them in, and it's all confidential, and of course we have to make them feel very comfortable doing the conversation. Let me tell you something about those kind of conversations. So they have to be serious and fun at the same time. So you really cannot embarrass the patient with questions. Let them talk. Let them say listen to them. That's my goal. I sit with them for 30 minutes, sometimes 45 minutes. I just listen to them.
Do you often do couples?
We did couples, and actually it was great. So in couples, usually what happens is women come in for something, they see our services, they go like, can we bring our husband in?
Yeah.
Can you treat him for that? And I say like, of course, I'll be happy to see them. So yeah, we do couples too.
Yeah, I would think, because in a relationship, it's important for both. And, especially when women get into menopause, as we get older, things start to happen to both men and women.
Definitely.
So what could be going on with your spouse could also be an issue within the woman. Mm-hmm. So let's break it down first with men. Mm-hmm. So what treatments do you have to when you're working with men?
Yeah, so for men, we offer a variety of treatments. We start from simple things like erectile dysfunction. It's not simple, but it's simple to treat. They're not hard. And everyone is different. It depends on their condition, if they have some illnesses, if they have diabetes, if they had a stroke before, if they are on certain medications. That will make a big difference, okay? So we do offer treatments for erectile dysfunction for men, and we do a variety of treatments, including PRP shots, platelet-rich plasma shots to the genitalia that will improve.
I don't even have that genitalia, but that's gotta hurt.
Yeah, well, we make it as comfortable as you can imagine. So basically, we have a special way of making the procedure comfortable, okay? What does it do? It improves the vascularity of the genitalia. It improves erection. It improves sensitivity, and it prolongs the time for people to have intercourse for men.
So is that, so what I hear you saying, that could help out that 1 minute man?
Exactly. So that's something that I get a lot. I mean, and some patients, they don't want to do that. They don't feel comfortable, so we offer them pharmacological treatment. We have a variety of medications that can help them achieve that erection and at the same time last longer. So my goal is to listen and analyze, and then I will give the solution.
I feel my face is blushing.
No, you don't have to. Those are
I
like...
know. It's just it's not a conversation you usually have with a stranger.
Right? I'm used to it, so... Okay. So, and then also we have something called Shockwave Therapy.
That sounds scary.
No, it's not. It does sound scary, but actually is a collection of shockwaves that we apply to the genitalia for men. It really improves the circulation and help maintaining erection and initiating an erection. So those are packaged with our other treatments to achieve the best result.
I know that it's a lot of emotional issues that come into play when you're I'm not a man, so I can't even understand, but I can get that it, because there are some women that have issues too,
Yeah.
that, and being able to take care of that and have a healthy sex life has to be so empowering for someone and build their confidence. And
Of course. So like, those problems for men can affect them directly by lack of confidence, low self-esteem, feeling down. That's what I see. By improving that, they will feel they're new men. They can.
can you make them feel like they're 18 again?
Well, not 18, but there's a big. There are a lot of studies, and we've done a lot of treatments, and we treated and helped a lot of men achieving those goals. Hormones play a big role in that too. So most men, they go to see their regular doctor, and inside them, doc, can you check my hormones, please? And the doctor will be like, why? You don't need it. They do need it, because men after the age of 35 and up, they start having hormone imbalance. The men drive is testosterone, and if the testosterone start to go down, they start to have problems with their mood. They start to have problems with their sexual health, erection, okay, and a lot of issues. So they go to their doctor, they insist on having that done, they do the check, turns to be okay. The numbers are fine for your age. Go home, nothing wrong with you. Actually, being a hormone specialist and treating patients for that problem, I've seen people who does well with a testosterone level of a 500, and others they don't. So your goal is to optimize it. 500 is still okay, but for some men it doesn't work. It doesn't give them what they want, because really it's 700 or 800 that will give them what they want.
So do you do the pellets?
Okay, so we do have the pellet treatment. The pellet treatment is actually for men and women. And the pellet
I
treatment.
did the pellets.
You
before,
did?
yeah.
How do you like it?
Well, it was years ago.
Okay.
I did do both estrogen and testosterone.
Testosterone, okay.
And I did feel like it did bloat me a little bit, like you do.
It does. So, so for some women, they do have this issue, but you have to balance it correctly. So I do balance it with other things, supplements. You have to get supplements with that to overcome those issues like bloating, water retention for women. But they do definitely increase the sex drive. They increase libido. They improve the muscle gain for women, especially for those who work out. Another thing is a big problem for women is fat around the waist area, and they don't know this is because of low testosterone and high estrogen level. So you have to balance that. So a lot of my weight loss patients, they have this issue, resistant weight around the waist area. So after optimizing their hormone levels, they feel great. They start losing weight. They feel energetic. They go to the gym. All these things by doing a simple thing.
I think with a lot of women, it's thyroid issues that go undiagnosed all the time.
Oh, yeah.
They'll say, no, that's in the range and that's good, but I have thyroid. And no, in the range for me is not good. I want to be on the lower level of normal range.
Correct.
And then I feel great.
Definitely. So when we optimize hormones, we don't just optimize testosterone, estrogen, and progesterone. We do optimize everything. TSH, which is the thyroid check.
Yeah.
Okay, thyroid hormone. We do have a lot of stocks. So we have something for like sexual dysfunction, something for lubrication, something. So we do tailor the treatment to the patient's need. Some women, they have issues with only lubrication. They don't have enough. They probably won't need the pellet. They probably just need like simple solution
like a cream or something.
Estrogen cream will help the problem. Will treat the cause and make them feel good again. Okay. So all of the above is those are things that we usually address. And talk about in the office and tailor the treatment to the patient's need.
So, I mean, we briefly started talking about women, but, I just did a a workshop the other day on, and part of that, even though it was a financial discussion, we talked about menopause, and that's a huge subject for women.
Right.
Because it's not talked about enough, and we don't really know when we're starting. We think we might be starting, and then you go through, I mean, I remember when I started menopause, I didn't even realize I was doing it, but I was standing at the credit union, and this woman just couldn't understand what I was saying, and I could just feel myself ready to just explode on her. I didn't, but I was like, what the heck's going on with me?
Right.
You know, like you know, and then you're sweating to death at night, and all of a sudden you're taking all your clothes off because you're so hot. I mean, it's a horrible thing for women to have to go through and to talk about, and then not every doctor, they'll be like, you're just going through menopause, and don't do hormone replacement because, you know, you might have get cancer and all this other stuff, and we know that that's not true.
Yeah, exactly. So let me tell a little bit background about hormone replacement. So a lot of women, they're worried about hormone replacement therapy, and they're like, no, this is something I don't want to do, okay, because it causes cancer, breast cancer, endometrial cancer, a lot of cancers. There was a study several years ago, 20 plus years ago, Women Health Initiative study. I don't know if you heard about it.
I did.
So what they did, they tested hormone replacement therapy for women, and they came up with scary numbers, like horrifying numbers, like how women, they get cancer and they had to cancel the study.
Yeah, but wasn't it like women who are like in their 60s and I can't remember the exact details of the study, but it was so inaccurate.
So it was so inaccurate, the numbers were like off, and everybody like say, look, okay, this is it, we're not going to do that.
And women went for years not doing anything, trying to do natural remedies for, and there are some things that you can do naturally, but went through menopause and wouldn't do hormone replacement because of that study, which was so wrong.
So what they do, of course, as you said, they do natural stuff. They sometimes opt to take over-the-counter supplementation for menopause, for hot flushes, all of the above. But sometimes it works, sometimes it doesn't. So just like any other medication you take, sometimes it does work for you, sometimes it doesn't, and actually cause harm to you. The thing with the hormone replacement therapy, and specifically the bioidentical hormone replacement, and I'm going to say that, and I know there are a lot of physicians out there, they are not convinced about that. They say like, well, it's a medication, it's still a medication, it can cause cancer. To be honest with you, the study showed the other way around, okay? Actually, it does improve women's health and men's health. They're extracted from plants, so they're not synthetic the way they make those vials and medications. There's no chemicals to it. All they do is they put it in a small pellet, and you can implant it, or you can do the cream, or even the gel, or the tablets. Okay, so those are from natural sources, from plants. Okay?
It was life-changing for me. I mean, life-changing. You feel normal again.
It does. It does make men and women. So I say like menopause is not only for women, it's for men too. So they do suffer from symptoms when they're like 40 or even 35. I've seen people who come into my office, and they don't have sex life anymore. They can't. They're either like they have low libido, they cannot initiate or maintain erection, and this is a very big problem. Even when you have an erection, your intercourse, and you can maintain it, you cannot maintain it.
That's a problem.
That's
a problem.
That's actually a bigger issue. It's a problem.
That is a huge problem.
You lose it, so
right.
That's that make them really, really down. So our goal is to solve that problem and eliminate that. So we don't want them to have issues during their intimate moments.
But even for women, you hear women going through menopause, and their sex drive goes so low, and then we deal with the vaginal dryness and low sex drive, and then you've got the husband, maybe he's I'm ready to go,
right?
But the wife doesn't, and then he gets discouraged, and then she feels like honestly, you just feel like crap.
I understand. I
You
get
just feel
that.
like crap.
So it's for both men and women. It does happen for men and women. So that's why optimizing sexual health for men and women, it improves the relationship, it improves life overall. It make men more productive, make women happier. That's it. So very simple.
So I know we didn't talk about this question beforehand, but I know that we did kind of talk a little bit about it, the Scream Cream.
Mm-hmm.
So, which is for women.
Yeah.
Because I think, surprisingly, there's a number of women out there who have never orgasmed before.
That's correct. Okay, so that's a whole big subject. A big sign there. Okay, so basically what happened, when women go into menopause, even younger ones who are still not in menopause, they do have this problem. They don't achieve orgasm quickly, and this is a big problem for women. I'm telling you, it's a major concern. Okay, so what are the causes? So there are sometimes simple things, just a medication that you take, or even over-the-counter supplement that you take, and you're not aware of the side effect. Okay,
interesting.
Yeah, a lot of SSRIs or SNRIs, those are depression medications, antipsychotic for people take for sleep and other things. They destroy your sex drive. They kill your libido and orgasm. So that's something that we have to eliminate first.
What's a common supplement that messes with your libido that people are likely taking? Is there, like, if I came in and gave you a list of supplements and you would go right off the bat, this is...
Well, there's a lot of things, I don't recall something specific now, but sometimes what they do, they mix stuff together, and this is, for example, for, let's say, this will improve your overall energy or something, or this is for calming, this is a calming supplement. It makes you calm. You're anxious, you're stressed out. So when they put stuff together into those supplements, it can really
that seems like that would make sense. So if you were taking something to calm yourself over the counter, that it likely is calming your whole body down.
Then it will decrease that orgasm for women. So another thing is, of course, vaginal dryness. That's another thing. Other things like, sometimes they don't have that desire. They don't feel it. So that's another thing. They don't achieve orgasm easily. And finally, hormones. If the hormones are off, if you don't have enough estrogen, if you don't have enough progesterone or testosterone, it can affect that. Back to your question
about
for
the
Scream Cream. So Scream Cream is actually the brand name. It's a compounded medication. It's a cream actually, and it's a mix of stuff. It looks. Women can use it 10 to 30 minutes before sexual intercourse, and it will definitely help them achieve a better orgasm. Yeah. So it's a state-of-the-art medication. And we do recommend that.
Hey, I'm saying I think everybody should run right down and pick that up.
It's a really good product, and there are a lot of varieties, give and take ingredients. Some stuff we ask the pharmacy to remove. Sometimes we add ingredients to it because we want it to be tailored to the patient's needs.
No, I know on the other hand you have a thing called a sex chew. So that's more for the man.
Men, yeah. So sex chews, okay. So sex chews or troches. Troches are a small tablet that you put under your tongue or between the gums, and it will absorb, okay? Why we like sex chews or troches? So, those moments sometimes when a man and woman want to have it right now.
Yeah.
Okay. And that man has an issue, and he knows that he has an issue. Okay. And then what's going to happen? He has to take the blue pill, wait for 30 minutes. Sometimes if he ate, he has to wait like for 2 hours, and then it's gone. Has nothing in there.
So it gives you more of that being able to be spontaneous.
In 10 minutes, they'll be able to initiate erection and maintain it. and it's very powerful. There are several components to it. There are ones for increase the time for men. There are ones that increase desire and pleasure for men. Okay, the same thing, as similar to cream ingredients. Yeah. So there's some.
That's the most perfect name for that.
Yeah, right.
It's the most perfect name.
It is. It is actually. They scream. Yeah. So,
Yeah.
so yeah, and then so the sex shoes work in 10 minutes. They'll have an erection. It doesn't have to go through the digestive system, through the stomach, and wait, to get absorbed to the bloodstream. It's absorbed directly through those small capillaries in your mouth and the men's mouth, and it will go to your bloodstream in like 10 minutes, and they will have that magnificent erection.
So are there any non-surgical treatments that you want to talk about? Are there any others, or do we
Of
cover
course.
everything?
So as I mentioned in the beginning, PRP treatment or platelet-rich plasma, and now we're doing something called PRF, which is more concentrated form of PRP. Okay, we do inject that in the genitalia for men and also in women. It helps improve for women. It helps improve lubrication, sensitivity, and increase orgasm.
So is this like something that you have this injection once a month, or do you have to go?
So we do usually recommend 3 treatments 4 weeks apart. And
So it's
that's it. It's one.
That's it?
That's it. And then it should give them results for at least a year. Okay, so they should have and maintain that at least a year. But keep in mind, everybody's different. If you have issues with your health in general, if you're like 65 or 70, that's not going to work all the time. Actually,
be careful when you say that 65, because I'm 60.
Oh, you don't look 60. You look much younger. Okay, so yeah, it's because of the quality of the plasma that we extract from your blood is not going to be the same as when you were 20 or 40.
Right.
Okay, so we do recommend some supplements with that to enhance erection for men and enhance lubrication and sexual health for women. If you want to get something over the counter today and start to improve your erection, so there is something, so the amino acid called arginine. So arginine is really a potent vasodilator that will help to achieve erection and maintain that erection. So, and again, I do not recommend that you go and take it without talking to your doctor. So very important, if you have a health condition, you have to talk to your doctor, or you can talk to me, and I can answer that question. So basically, there's stuff that we recommend for men and women that will help the cause. Another thing that we do, and then this is going to find it funny, is we help men to have issues with their penis size. We can help them non-surgically to increase that.
Really?
So, yeah, we have a program for 6 months, monthly PRP injection, and some tools that we give the patient to use at home. They can really have an increase in the size, about 1 inch in length and about
1 inch, that's a lot.
and 0.5 inch in girth. So it does work, and there are studies to support that, and we do have that system.
I think you should be talking about that all the time.
I know,
'Cause
right?
I think a lot of men's self-confidence is based on the size of their...
Right, but just to give you good news, guys. So it's not always the longer is the better. I'm just letting you know. So it's
Sometimes
always
girth is nice. Girth is nice.
it's very subjective
Yeah.
between men and women.
Well, I think everybody has different, different desires, and bigger isn't always better.
Oh no. Oh no. No.
It isn't always
It's
better.
not. It's not. Actually, it's and men have issues with like their penis size because they think they're either like it's too short or too like it's actually you have to go by the average. What you see on the
pornos are not right.
Yeah,
Pornos aren't correct.
This is not reality. Unfortunately, it makes, especially for the younger population, it gives them a trauma, like a psychological trauma, like
think
what
it
they
gives-
see,
yeah.
like what they see
Well,
on.
they do the same thing for women. I
Of
mean, they
course.
put us on these, models that are so skinny and say this is what you're supposed to look like.
have, yeah.
And that's
Another subject.
Curvier women are so much more sexy than somebody that's, super tiny.
Yeah, what do you see on porn websites is not always reality, and actually it gives people trauma because they really want something and they don't get it, so it's a feedback. It's a negative feedback.
Well, this has been a very enlightening conversation. I've learned a lot. And,
Thank you.
I know that in conversations that I've had with friends, and I don't really have conversations with men about this subject, but with women, there's, as we're getting older, it's tougher, and we do want an active sex life.
Of course.
We want that intimacy.
It shouldn't stop at any
No.
age, to be honest with you. No.
It shouldn't stop.
No.
It shouldn't stop.
Yeah,
so
it should-
I think everybody should give you a call.
Of
I mean,
course, yeah, I'm happy to help.
Yeah, I've learned a lot.
Thank you so much. Of course, our goal is to make you look and feel better. So in our center, we do a lot of aesthetics. We do a lot of beauty procedures, and at the same time, we focus on the overall health. That's our goal, to make you and feel better.
Well, I think when your overall health is better, everything's going to be working in your
Of
body,
course.
So much nicer.
Yeah.
So I do have to let you go, though I could probably sit and talk to you for a long time,
Of
because
course.
it's been very educating to learn about, especially the non-surgical kind of things, and something that you can take to increase your confidence and within 10 minutes.
Of course,
Within
right.
10 minutes.
Yeah.
Okay, so thanks again for joining us today. If you're having issues or just want to and really just enjoy your life a little bit more, give the doc over here a call.
Of course, thank you so much again for everyone. Please don't hesitate to call and talk to me. I mean, I'm happy to initiate that conversation, even if you decide not to do anything. I'll be happy just to guide you through and let you know what's going on and how can we help you. It's my goal to make you feel and look better. So thank you so much.
Thank you.
Thank you.
Thank you. So tune in next week when we're going to be talking with Amy Bellinger about, actually, weight loss.
Perfect.
So thank you.
Thanks for watching Unstoppable. Do you have a question for Paula? Send it our way. To schedule a one-on-one consultation, give us a call. Unstoppable is brought to you by Paula Swain and the Financial Center for Women. Dream, grow, thrive.